Hello, my name is Doris Terillian. I am a nurse anesthetist and a ketamine therapy provider at KETamine. Today I'm talking about different routes of ketamine administration. When considering different routes of administrations, we need to think about the bioavailability of a drug. The bioavailability refers to how fast the administered drug, for example ketamine, gets absorbed into the circulation and how quickly it gets to the action site where it's intended to work. Hence, the bioavailability of ketamine is influenced by how it is given. For example, let's pretend you're a patient looking to relieve depression and you decide to get ketamine therapy. You want the entire dosage of ketamine administered to reach to your bloodstreams as quickly and safely. You also want the ketamine to immediately start working to relieve your symptoms. So I offer you an IV infusion instead of other routes. You ask me why? Well, first off, the IV route is the most common and most studied ketamine route of administration for the treatment of mental disorder. With an IV infusion, ketamine molecules travel from the IV directly into the bloodstream. It does not make any stop at the gut to get absorbed or the liver to get metabolized. It gets absorbed straight away into the bloodstream, all 100% of it. It then goes to the brain and immediately does its job. Additionally, with an IV infusion, I can titrate the rate of the infusion. So not only the IV route provides 100% bioavailability of ketamine, but it gets to the brain quickly and safely. Okay, so let's talk about the intranasal route. There are many variables to factor in when considering how much of ketamine is getting absorbed from the nasal membrane. These factors include the integrity of your nasal membrane, the shape of the nasal cavity, its moisture content, as well as the accuracy of the aim. The bioavailability of intranasal ketamine is 30 to 50%, and the rate of delivery to the brain is uncontrolled and variable. The third route is the oral route. When ketamine is taken orally, its bioavailability is generally decreased because it has to first get to the gut, get absorbed, get metabolized by the liver before it is available to start working in the brain. We call this process the first pass metabolism. So as you can see, there are much more steps involved with oral route. Hence, the bioavailability of oral intake of ketamine is about 15%, and the rate of delivery to the brain is uncontrolled and the slowest of all routes. The last route I want to discuss is the IM or intramuscular injection. Once again, there is simply no way to control how fast the ketamine molecules get absorbed into your bloodstream. Once it leaves the needle, it's entirely out of anyone's control. The bioavailability of IM ketamine is 93%, and the rate of delivery to the brain is uncontrolled and variable as well. So there you have it. I have explained the different routes of ketamine administrations and also why most ketamine clinics prefer the IV infusion route. Thank you for joining me. Have a good day.